Namaskar. Today we are going to do a thyroid embolization case. This patient is 24 years old lady. She is having the Graves disease, having the swelling in the neck, and when we evaluated the patient, she had the Graves disease with profound symptoms, and she wanted to treat the thyroid without surgery, and we are fortunate to do the thyroid embolization for her, thyroid artery embolization for her to treat this Graves disease, and we have taken up the case after seeing all the blood reports and the parameters and final diagnosis with the Graves disease. Now you can see in the DSA, we are doing the case. This is the our angiography suite. इस पेशेंट को हमने राइट femoral artery puncture लिया है in the groin, and we approach the thyroid artery from the right side of the groin or the right femoral artery. For that, for the thyroid artery embolization. Now you can see we have cannulated the right side thyroid artery, and there is the abnormal blush in the thyroid. और अभी हमने थायराइड आर्टरी एम्बुलेशन शुरू किया पीवीए पार्टिकल से 300 to 500 size PVA particles. You can see here slide. Yeah, you can see slowly we are putting the particles. That is the it is a type of medications of the particles by which we embolize the thyroid artery abnormal branches, so that the abnormal functioning thyroid gland is embolized and blood supply is blocked, and the thyroid level should come down. Yeah, this is the end point of our thyroid embolization, and it is done. Today, this patient, she had the Graves disease of thyroid. Today, we have done the thyroid artery embolization for this patient as she is having the Graves disease. इस पेशेंट को ग्रेव्स डिजीज था. आज हमने ग्रेव्स डिजीज के लिए थायराइड आर्टरी एम्बुलाइजेशन किया, मेडिसिन देके पीवीए पार्टिकल्स देके using the catheter guidewire combination, and now she is fine. We are going to shift this patient to ward now.